My name is Letitia Davis, and I'll be giving an oral presentation about the bacteria Bordetella pertussis. Bordetella pertussis resembles the structure of a rod-shaped organism. This microorganism is very powerful and is responsible for causing the disease whooping cough. Whooping cough first originated in Paris, however, it is very common in the United States. Bordetella pertussis attacks and forms in the respiratory system. This disease directly attacks on individuals' lungs. In this presentation, I will discuss the bacterial disease Bordetella pertussis. Specifically, I will discuss the pathology, management, pharmacological impact, and prevention plan for the bacterial disease. As previously stated, whooping cough is the most common disease caused by Bordetella pertussis. This disease can be especially harmful to babies and sometimes result in death because babies' immune systems are not fully developed. According to the CDC, whooping cough is contagious and is easily spread from one person to another. The disease is airborne and travels through the air when an individual infected coughs or sneezes. Bordetella pertussis is gram-negative coccobacillus and ideally grows in warm temperatures ranging from 95 to 97 degrees Fahrenheit. Bordetella pertussis is a complex microorganism that does not move and grows slowly. In order to be infected with Bordetella pertussis, bacteria must enter a person's body and attach to the ciliated epithelial cells in the respiratory tract. When this happens, the bacteria multiplies in size and settles on the cells. Virulence factors. There are several toxins produced by the organism, and pertussis has multiple virulence factors, which I'm going to name a few. Adenylate cyclase results in the inhibition of phagocyte function. Domer necrotic has weak sequence and acts by deaminating specific signaling proteins. Pertussis G protein affects transduction in cell types. Filamentous hemagglutinin, surface protein that participates in the interaction of Bordetella pertussis, classified as an adhesion. Perdactin contributes to bacterium host cell. Fimbriae functions as an adhesion and are the basis of Bordetella stereotyping. Lipoglysaccharide is a molecule that is an active outer membrane component in Bordetella pertussis. Tracheal cytotoxin kills respiratory epithelial cells. And the pathophysiology. The disease interferes with the natural pathophysiology by causing exposure, tissue attachment, production of virulence factors, avoidance of host defenses, cell and tissue damage, and prolonged infection. Next, I will be discussing symptoms, early, late, at-risk individuals. As far as location, many countries are infected by the disease. A lot of cases, approximately 200,000, are confirmed yearly in the United States. As far as race, research from 2001 to 2003 indicated that the Caucasian race was the most affected by whooping cough. As I previously discussed earlier, as far as age, the disease caused by Bordetella pertussis mostly affects young infants, small children, but adults are also at risk for being infected. In significance, the disease was once significant in the community. However, due to prevention measures and treatment, it is no longer as big of a problem. Disease management. Bordetella pertussis can be difficult to identify because it mimics other infections. Treatment for whooping cough is vaccinations. There are two types of vaccinations that can be provided. One, known as DTaP, is used for children younger than 7. The Tdap is used for individuals that are older than 7, teens, and adults. As with most vaccinations, there are mild to severe side effects that may become present when the vaccine is received. These include fever, seizures, nausea, and severe bleeding, to name a few. Pharmacological impact. Antibiotics are a form of pharmacological treatment. Research shows that depending on the antibiotic, short and long-term treatments can be effective. Some of the short-term antibiotics given include azithromycin and clarithromycin. They are administered 7 days at a time. Long-term antibiotics administered include erythromycin estolate, which is administered over a 14-day period. Prevention plan. There are 2 types of preventative measures that can be taken. The first is vaccination. Individuals who are vaccinated reduce the risk of being infected by whooping cough. Safety measures such as practicing good hygiene can also decrease the chances of being infected. If an individual is infected, there are also steps that they can take. The first is to thoroughly wash your hands with soap and water for 20 seconds. The second is to cover your coughs and your sneezes. And third is to practice social distancing. You should never be in contact for long periods of time if you are infected, because you can pass the airborne disease to other individuals. And in conclusion, Bordetella pertussis infects individuals with whooping cough. This disease can attach to the respiratory system of all individuals, no matter their age or in ethnicity. Treatment for the disease include vaccination and antibiotics. If infected, preventative measures can be implemented to prevent the spreading of the disease. Thanks for listening.